part of a greater vision of a Jamaica in the future that will become the health hub of the Caribbean and the Americas. That is the vision. So it's not just smoking and banning smoking. It's creating a country with a smoke-free environment while you are able to offer quality service at the community level at your clinics, and you have your hospitals now offering the bigger items, which, as you all know, per person it costs you more to go to hospital than to a center. So you really want to encourage persons, and this is in keeping with the manifesto of the People's National Party, where primary health care is and will be the point of focus. So all of that is tied up in a vision. So it's not a little, an overzealous minister trying to do anything. It is a studied approach, looking forward to that Jamaica. I might not be around to see it, but I know from the smoking alone, in another couple of years, born out of the experience of Northern Ireland and other countries, you begin to see less heart attacks, you begin to see less strokes. And many persons don't make the association between relatives who might have had things. We are Jamaican, you play domino and one man on the table every Friday night or whatever, and there's some constant smokers. You don't smoke. We have taken it. I went down to Corner Regional about a month ago. Security guard called me and said, "Minister, thank you for the bag, because only weekend we just bury one of our co-worker. Lung cancer. She never smoked a day in her life. I was not too. And she did. And so what he has successfully done is to love her to death. And the truth is that in that kind of scenario, he would have been, I'm not saying do it deliberately, or try to do the other way around, but he would have been at that funeral, crying and bawling and going through. But the evidence is clear that he would have murdered in a certain way. His back indirectly. So it's not anything that, and if you look at the developing countries now, you're seeing less of these diseases because the more progressive, like Canada, smoking, ban smoking in enclosed areas. And when I look, there are people bawling about the 5 meter that we are talking about. And I go down to that state, it's 30 feet away. I was still someone else up on a one of the things. Well, 30 feet away. And up to 5,000 Canadian dollars. That's not a little bit of money for cigarettes. You understand? In Jamaica, a 20 pack a day is $250,000 a year. That's the economics of it. 20 pack is $250,000 a year. You understand? So just burn that out. I believe that if we continue on the present path, Jamaica's future in relation to health will be a sound one. I have absolutely no doubt that we are moving in the right direction. They're coming out of this week and the discussions. We signed today a MOU, Memorandum of Understanding with Sunnybrook. We're going to be signing one with Kids tomorrow. I have just set up a think tank and advisory body for the diaspora, because I believe that even as we spend $35 billion in Jamaica for health, there's much more than that out in the diaspora to harness. And what I know, moving to set up a structured program. Albert Timberlake is the director of international National Corporation Unit on Health. She's the person that relates with commission. Jamaica has an average of 200 missions annually. Last year we had 172. And we are working towards getting structure. I'm a system man, I believe in systems. And once we begin to put systems in place, that is why we are setting up systems of excellence and centers of excellence. All our regional hospitals in due course, we're working towards them becoming centers of excellence. We have challenges with ambulance. We know when I get back, Mr. Anderson, who is the CEO of the National Health Fund, we have 19 ambulances just arrived to be distributed across. We are moving last financial year, we spent $375 million improving hospitals. We just broke ground a couple months ago building a female surgical ward for St. Anne's Bay Hospital. When I get back on Friday, I'm going back to break ground for obstetrics and gynecology ward at St. Anne's Bay Hospital. We have done significant work at a Nottingham hospital in the post-Sandy period, moving it to carry into a Type B hospital. We are seeing some changes. It is a work in progress. It is a journey, not a destination. And so we are moving quietly, but we are getting there. I get out there on a Friday to visit hospitals elsewhere first time, because as minister, I have a responsibility to know what is happening on the ground. Yes. You don't want to stay in office and people tell you about this and tell you about that. Oh, nothing beats going facilitate for the good. Yes. And that is the strategy. So I want to say to you, ladies and gentlemen, in the diaspora, you have been doing excellent work, both in terms of your personal achievements and in terms of how you have helped Jamaica land you will be now. We appreciate it. We don't take it for granted, because we know everybody can come back to Jamaica. Don't make a sense island, don't have enough space. So, because, you know, there are some people that come, oh, you come home next year, they know they're not coming. And they can make a much greater contribution from being here. You understand? Because it is you as the thing that have opened up this opportunity with Sunnybrook, and that's going to happen being home. So we have to value being here for those who can return. And I know we have our friend Blondell Evans Reed, who's writing the Going Home or Coming Home book, and I recommend that we all read it. I certainly will read mine. So we want people to come. And when you come about being in North America or any other place, because I went to Malawi. About 4 or 5 weeks ago. And while I'm at the conference, I get in a message to a Jamaican family inviting me to dinner. The best food I eat. I was there. Everywhere across the globe, Jamaican. You go Alaska, you will find them. And they are doing more. So let us not beat up on ourselves. We have left Jamaica, we come here and we have done well. Many of you have been able to send your children to university. And they have done well. When I look across Jamaica, at the US and Canada, it is Jamaicans who are the top leader. And the Smith, his father is Jamaican, and from Sunnybrook. He is now the executive vice president and the chief of staff at Sunnybrook, the top man next to the president. And he's the man who's there. Love Jamaica. But we see Andy, you know it's come from Jamaica. Father must have been a very white. Then you have Martin Corbin, good man. He came to Jamaica Friday, flying Friday afternoon, work with us and catch a flight home Friday night to come back up in preparation for this visit. And in 2 days, you see how the energy. We get a container supposed to move out shortly of medical equipment coming from Sunnybrook. You understand? Let us not devalue your work in these parts. It is helping Jamaica, and in many regards it is good for Jamaica. And it is this minority in North America, or the minority in Jamaica that give Jamaica a bad name. The minority. Jamaicans are good people. Good people. You tell me which other nation our size and population can command that which we have. I mean, going back to the World Games, I mean, the Olympic last year, it comes, it is a normal thing to have our people just a win and a go on. What is the world ever competed, you know? That's all it's there in the world, and we know for sure that we're winning. You think that's an easy task? It can't be easy. For you know that when we're competing against the best in the world, and yet we know 1, 2, 3, 1, 2, 4, and all that kind of thing. Look at that little young there. We were running out of lineage. That's right. That means not nobody around now. And come second. And you know the only man in the race can beat him in board. You know that, you know. And the only man can beat him in board. That's a great achievement. So I really want to thank you for the opportunity to address you. I will report faithfully when I get back home, my encounter. And we're going to have to work, whether we are in Jamaica or outside of Jamaica. We're going to have to make Jamaica, and keep it with our national development goals for 2030. We're going to have to make Jamaica the place of choice to live, work, raise our families, and do business. And all the time in the state and also retire. Thank you, ladies and gentlemen.
Mr. Minister, an associate of mine was able to acquire a few dialysis machines that they set up in Manila. Now, I tried to get the same to pilot machines to set up in your constituency, Princess Margaret. Now, I tried to get hold of you and to discuss this, because those machines are not, you know, you have to get right tight in order to what we're trying to get back. So I tried to get hold of you on your secretary on, and not allow it. So I'd like to know if what is your position with that business machine being set up in Princess Margaret?
Let me go. We welcome gifts, and we are now reviewing the gift policy. But when I became minister, I put in place a performance equipment task force to ensure that whatever is coming into Jamaica is of particular specification and standards. Because it is important that we don't just take things because it is available or because it has been thrown out by some institutions. We have had some very bad experience with that, where it gets there, but it becomes our burden really to get it to the door, because it just, or to the scrapyard, because it's really not functional. I would want to know that, yes, Princess Mary, which is in my own constituency, that we have a dialysis program. But every program is set up, there is a human resource element to it. Dialysis technicians and persons, whether it is a nephrologist at the higher level, those come by easily. And one of the things we have to be doing now is looking at setting up those systems of excellence in strategic institutions, rather than trying to set up in every little corner, especially because we have the sentiment. I know you're from St. Thomas, so you want to know Princess Margaret is the place. But we get it down and we don't have the manpower. It is going to be a big thing, going backlash. Because if you're not able to run it as it should, it costs the government $1.5 million annually to deal with a dialysis patient. $1.5 million. So it is, and that is just basically supplies, not manpower per patient and doctor. So you know, there's a lot of things that we say. Dan will tell you. Dan brought to Jamaica some first-class ophthalmology equipment, some new pieces. But we don't have the manpower to run a full-time ophthalmology clinic at Princess Margaret. And even now that I'm minister and can use my power, I would believe it would be unreasonable, given the manpower shortage, to say, because it's my constituency, we want this ophthalmology thing, and have to move persons from, say, a KPH, where you're getting a high level of referrals from every other parish, deprive them of having a first-class ophthalmology clinic that is in keeping with best practice. So it is not, I would still want to know some greater details from you, which I can get one-on-one, relative to whether the machines are available. We can get our local person, because we have one person in Toronto too that can check it out for us, because we would never want to refuse equipment such as dialysis machine. It's just that we might not be able to set it up in the area that we might want it. And we're saying it's the same thing that is happening with missions. We have a person coming from a little district, and you carry a, because you know, head of a department, that you carry a 40-strong mission to your little district to spend a week, and you carry a orthopedic surgeon. What that person comes to do is take blood pressure and do some other little things. It would have been better if we organize and get a person like that orthopedic or a general surgeon into the hospital system to do, where you could do some elective surgery, because some hernia and that those little ambulatory type thing. That person that made a much greater contribution than to come to Jamaica to the general medicine that some of them would not have done for 10, 15, 20 years. So it is a matter of how we manage the process. That's why I put this advisory body. We are strengthening international cooperation unit to put us in a better position, a structured position, to manage the gifts or the offers that are coming from our friends and family.
Some conclusive about works that they've been doing over the years that target certain chronic diseases that something that Jamaica is very popular for, known worldwide, right? And the reason why I'm bringing this up is also I'm a past graduate of the University of West Indies, and I lived on Chancellor Hall and saw people who were doing their masters while I was doing my undergraduate in the natural sciences, doing lots of work on marijuana research for medical properties, in which they had successful results. And over the years, successful governments, both your party and the other parties, they like the idea about, it's like they're waiting to see what's happening with the world, with what the world is doing. And what I'm afraid will happen, from an economic standpoint, for someone who is economics at university, is we kind of waiting to see what the world will do, and something in which Jamaica is very well known for worldwide. Some other places in the world will capitalize upon it, and then it will be too late because we're far behind in the race. Basically is, what is your government doing as Minister of Health, where benefits, keyword, benefits of the properties of medical marijuana that you will be looking into or pushing forward?
Okay, my being here, I met with a group specifically dealing with medical marijuana. As Minister, I will say that I continue to have an open mind, and I believe that the difficulty I have at this point in time is the fact that I have come with a bad enough tobacco smoking with some significant ban, while marijuana is about $12. And so I have a little problem as to how I pronounce, because when you man say, boy, the see, you know that is also, it's not, you know, tobacco that is legal, and cannabis or ganja that is illegal. But no, the cannabis has about 460 different chemicals, as opposed to the tobacco that has 7,000 different chemicals. 69, all harmful, 69 of them are carcinogenic, cancer causing. The case of cannabis, 460 of them are cannabinoids, which are substances that, from the research, are showing to have excellent value. I believe that this conversation has gotten to a point now where whether it is going to be me as Minister and my administration, or one could say in the future, but we can't escape it. And Jamaica in particular, the nature of our ganja is world renowned. The fact is that you still have to deal with the development of particular kinds of species to get the desired results. So it's not just a ganja with a good, the benefit with THC, right? But it is a good prevent kind of mutation. But it's an excellent question, and we're going to have that. I saw Gupta also, and he was an anti-ganja person, and now having seen the evidence, he has made almost a 360 turn. So
it's not very far away from here. And many times as government, you're entitled to set goals and SMART goals. And so obviously the Jamaican government has set these SMART goals, but many times they're not feasible. So you outlined tonight the success that your ministry has had today, but I just wanted to know if you could speak a little bit of some of the challenges that you foresee, because 2030 is not far away, and I mean for Jamaica to move from the current state that its healthcare system is in to that of a first world status, I think it's going to be very challenging. So if you could just talk to 2 or 3 of the challenges that you've received that Jamaica has.
Now, speaking to say, the challenge we now see has to do with financial under normal circumstances. The budget we have this year, 32 billion, which is the recurring, is a flat budget compared to last year. So it's really paid salaries and certain services. But as it relates to the capital aid budget, which is the project budget, this year we have $2 billion, the largest, in spite of Ireland. It is the largest capital budget that the ministry has enjoyed in a very long time, probably the highest we have ever had. The human resource element, doctors, nurses, etc., since becoming minister, has signed 5 agreements with the Cuban government for human resource, Cuban doctors, nurses, specialists in terms of primary care. We have signed up ophthalmology agreement, the Cuban Miracle Care, where they have seen, they have done over 10, from 2005, I think they have done over 10,000 surgeries in Jamaica. We renewed that contract. We have signed a biomedical contract and a services contract for Cubans to come in. They have gone through our hospital systems, critical health centers, and they have started the repair to a number of, equipment that is now was out of use. So we are moving in a direction. This is closing the gap. We're bringing in from Cuba too, for the first time, as a dental surgeon. For the first time, we're bringing in 6 dental surgeons from Cuba to help with the shortage in our system. The first batch of graduates from the University of Technology will come out of dental surgeons will be 2015. So in the meantime, it's really a stopgap. We're bringing 3 pathologists, and that is to help us in terms of our cancer program and other programs, the turnaround time for specimen. So those are direct things that we are moving towards. Ambulance, the last time we brought in ambulance was 2007. New ambulances. You get a little bit of a second-hand ambulance from time to time, but the last time we brought in as a government was in 2007 for work. So we brought in, we are bringing in 19 now, and we have a commitment of between 8 and 10 for the next couple of years to get us into a comfort zone in that regard. So there are no areas. Our accident and emergency areas in hospitals, we are paying special attention to those areas in terms of improvement. That was one of the big topics for discussion at Honourable yesterday, looking at accident and emergency, because there are, last year we had about 260 deaths from motor vehicles, and we have had continue to have significant violence related injury, and that is costing the government to do of about $2.3 billion just from violence related injuries. So, and much of that is domestic violence and that kind of thing. So these are some of the challenges, but I believe that if we continue on the same trajectory, we will be able to get. That is why we have, in the past, you probably have strategic plans. We have a strategic plan for the NCDs, we have a strategic plan for cancer, we have a strategic plan to begin this year a national health information system. So you can move from people-based records to electronic medical records. These are things that we're doing to improve the quality of the system that will lead to better quality care. The challenge, what I believe will be continuing to take part.
I want to first thank everyone for coming. That's really wonderful. The information is excellent. One of the things that you mentioned with respect to the perspective of the plan, even if the plan as we go forward with the tactics and all the details that would relate to the plan, right? What I've been seeing is wonderful, but what I'm missing is a lot of young people that really need can do to be able to help. And a lot of it is being able to do it in a way that relates to the Jamaicans, and you all know we're a little different in how we operate. You know, so it takes a little bit of a different method. So I'm wondering what you're doing, and I don't need you to answer that question, but I think it's an important point for people to understand. The challenge is so much of what you can do is how to disperse the information to change. The change management is a big part of it, especially in the the question is, plot and a process where you're recruiting people that have those skill sets, that people will be able to help you with the change management and execute on that level, so that we can really have success.
Well, one of the things that we would have to depend also on the diaspora for is to also develop a skill bank of those kinds of persons that you are thinking of, because the truth is that it is not easy to find some of these persons, and so that is part of the task and mandate that I believe on this side. If you develop that kind of skill bank, the Council General too can play a critical role in all of that. There was mention about the pediatric oncologists that we have. I'm also bringing in another one from Cuba, because we now only have one. Another one is coming from Cuba, and we are talking to others. So we are looking for the kinds of skills. I am hoping that by the first quarter of financial year 14-15, which starts in April, we would be in a position to break ground for a new child adolescent hospital in Western Jamaica. And that will take with it the need for specific skills. We want to know that during this period when...
Okay, let me put a question to you. We have been assisting in eye care in Jamaica through the St. Thomas Health Care and Clinic at Princess Margaret, but we've also been assisting in eye care with the Waterloo team over many years. Has vision care improved much in Jamaica since 1999, and how best can we assist you more than we are at this time?
We have seen improvement in terms of the response. Your team would have come in, and teams like yours, as part of missions, coming in, doing the testing, and literally that getting classes, almost immediately. As I said earlier, the Cubans, and I'm not discrediting what the Jamaicans are doing at KPH and elsewhere, but the Cubans now, they're doing things like cataract surgery and other things, and they are doing it at a rapid pace, because as I said, they have done in less than, I would say, 7-8 years, over 10,000 surgeries. So it's a lot of surgery, a lot of work. What we have to do, quite frankly, is to begin to deal with the risk factors, because part and parcel of the many issues we have with the eye tied into our diabetes patients. And it is that which, unless we begin to make from this strategic plan and our action plan, begin to deal with those factors. So the question of foods, although we have taken on tobacco, foods and nutrition is going to be, it's on the agenda, but right now it is a conversational thing. We don't have to come with a regulation. But we are looking forward to the day, and not too long from now, when we will also see calorific values on our products. So you know what you are taking in. You have a choice as to whether you want to eat A or eat B. These are some of the things that we're going to have to do. We have been looking at some of, in the industry, the cutback in our sugar intake, or the cutback in our salt as it relates to high blood pressure. These are some of the things. Gender persuasion. I would love to have before moving into any kind of regulation. But we have seen progress relative to the teams coming in and really doing work. But we are 60% of deaths in Jamaica, well, closer to 70% of deaths in Jamaica is due to the non-communicable diseases annually. And it is costing the country $170 million annually to treat the NCDs. Those are some of the raw statistics relative to the present situation.
And the one that you're talking about, can you share a little bit about what that is about, or what your understanding is?
It is establishing the opportunity for training of human resource development. It has to do with also transfer of technology, working with some group. And we have been the one to put certain things on the agenda. Cancer care, which is our big ideas project, is a big part of that, working with them to develop our cancer care program. And essentially, it is going to also put us in a position where we will be able to get from, because as you know, the connection to the University of Toronto, be able to get consultants to come to Jamaica to help with specific needs that you might have.
My opinion?
Yeah, I'm here with the
Dan Williamson.
the head of the Jamaica St. Thomas
Okay, represented from the Canadian Friends.
Friends of Jamaica with come to
Canadian Friends St. Thomas Healthcare.
Okay, so what's your opinion of the meeting tonight?
I think it was very informative. The minister was forthcoming. He answered all the questions directly. He didn't dodge them as a normal politician would do. And for that I congratulate him. And it appears that his mission has accomplished quite a bit while he has been here.
So, do you think Jamaica is facilitating your organization as it is concerning those that have cataract issues back home?
It is
Reverend Mitchell,
accommodating.
Reverend Mitchell, take your interview that way.
It is definitely accommodating our eye vision care program as best they can.
Ready?
Is there any more you think they could do, or the Canadian community can do to facilitate?
The Canadian community can assist groups like ours to finance larger and more sustained vision care program in Jamaica.
Well, again, Mr. Williamson, I thank you for your time, and I continue to hope that your organization will be assisted in a larger proportion by the different individuals here in Toronto, Canada, and I'm not quite sure if you're partner with anyone in the United States or in the UK, but those that in Jamaica who cannot afford glasses, I'm sure that they appreciate your effort.
We're associated with teams in the United States and also in Canada, University of Waterloo vision care team, and they're doing a wonderful job in the area of eye care.
Okay, thank you.
Okay.